And the topic of my presentation is to determine the role of transcutaneous retrobulbar amphotericin B in COVID-19 related orbital cerebral mucormycosis. So it was a prospective hospital-based interventional study carried out during the second wave of COVID-19. Transcutaneous amphotericin B was used as an adjunct therapy along with other supportive treatment in patients of ROCM with orbital involvement after applying the inclusion and exclusion criteria. 7 patients were given the injections during the course of the treatment, but due to loss of follow-up, we are presenting 2 cases with ocular outcomes with post-injections and followed up till 6 months. So inclusion criteria was willing for the injection, those having signs and symptoms of ROCM, a nasal swab showing the aseptate hyphae, preserved vision with focal involvement of the orbit. Exclusion criteria, negative fungal biopsy, and patients with disfigured, painful blind eyes with frozen globe were best exonerated than to be repeated at TRAMB. So at presentation, the patient was subjected to multi-speciality evaluations, which included ENT, ophthalmology, general medicine, and nephrology, and ophthalmic examination, visual acuity, pupil reaction, slit lamp examination, and the fundus with grading of ptosis, proptosis, and extraocular motility. And the patient was subjected to throat swab for COVID-19 RT-PCR, and the predisposing factors for invasive fungal infections were noted. Regularly, laboratory investigations were done, MRI was done, and the patient underwent FES under GA, and tissues were sent for histopathological examination. So injection protocols was, that is to a vial of 50 milligram of lymphocytes, that is 10 ml of distilled water was added to make a concentration, and 0.7 ml was drawn and diluted to a concentration of 1 ml with the concentration of 3.5 milligram in 1 ml by adding 0.3 ml of the distilled water. So under all aseptic conditions, after getting the consent of the patient, it was given, and patient received 3 doses of TRAMB on alternate days. The first case is 36-year-old male presenting with chief complaint of nasal stuffiness and nasal discharge for 10 days. He was a known case of uncontrolled diabetes mellitus on oral hypoglycemic since 2 years. On ocular examination, vision was 6/6, extraocular movement restriction of abduction in left eye with the normal ocular movements in the right eye. Pupils right normal size and reacting, the left showing the brisk reaction, and anterior segment, the left eye ptosis with no proptosis. So dilated fundus examination was normal. So this was the MRI showing the bilateral ethmoid maxillary sinusitis, left optic nerve with retroorbital fat haziness, left optic neuritis, indentation and displacement of the left medial rectus from the lateral ethmoid cells. So we can see here the improvement after the 3 doses of the TRAMB. So radiological improvement also after the 3 doses of the TRAMB. The case 2, 40-year-old male with who presented to the Department of ENT with the chief complaint of bilateral nasal stuffiness and discharge. He was known case of diabetes on oral medication since 2 years. So on examination, the vision was 6/6. The right eye abductions were limited, and the left eye extraocular was full and free and painless in all the cases. And on MRI, we can see the bilateral maxillary sinusitis right more than the left with the involvement of the right sphenoid sinus, soft tissue stranding to the inferior and the medial aspect of the extraocular fat on the right side with hazy right medial rectus and inferior rectus. Brain showed no involvement. 3 injections were given, and we can see the improvement after the post-injection. So here the radiological improvement can also be seen. So after 4 months, he again presented, this patient, again presented with the pain and swelling in the cheeks. Blood sugars were normal. Patient was investigated again in detail clinically, microbiologically, and radiologically. He showed osteomyelitis of the right maxilla. It was the old sequelae of old infection. So right maxillectomy was also done in this patient. So the conclusion, in our study, we have treated all the patient with FS and amphotericin B, and it can be given in the limited ocular involvement, and it can be considered as a therapeutic adjunct in managing the cases of ROCM as a globe-sparing intervention. Thank you.
Why did you prefer L-amphotericin B rather than plain? What was the advantage of that?
So, because it has the availability issue, sir, at that time, and also it is because of availability and the cost issues.
Okay, it is supposed to be less toxic.
It is also less toxic, sir.
Did you observe any complications of this injection?
No, sir. In all the 7 patients, after giving the 3 injections, we did not see any complication. But ratherly, we were following regularly these patients, and for a long follow-up, only these 2 patients were available, so we have included. But no patient we have seen no.
For how many months you followed up?
Yes, sir.
For how many months you followed up the patient?
So these patients came for 6 months. Others we lost to the follow-up, so we didn't. I didn't show here.
So you mentioned the 2 cases.
I have mentioned here that only the 2 cases.
Right.
So this, out of the 7 patients, was there any telephonic communication to understand whether they had, they had loss of life or some severe comorbidity? What was the reason why they didn't follow up, or any of these patients underwent exenteration out of the 7?
Ma'am, we tried, but I will also follow them with the ENT people also. Because of the photo and the picture, CT, MRI, these only these patients we have of these patients. So I have included to show the improvement. Because MRI scan, many patients didn't get the MRI scan after the post injections. So these were the few limitations for which.
Okay.
Thank you, sir.